Hello students. Welcome to chapter 19, Coronary Artery Disease and Hypertension, Part 2. So heart failure. Congestive heart failure is a form of chronic heart disease, unable to maintain an adequate cardiac output to sustain normal blood circulation. So we know the triad for heart failure, right? Edema, shortness of breath, and the vein distensions, right? The resulting fluid imbalances make basic functions of living, breathing, eating, walking, sleeping difficult to perform. Again, patient is going to have problems with breathing. That's why the shortness of breath, eating, walking because of the edema, and sleeping. The most important risk factor for heart failure is coronary artery disease. The most important risk factor is coronary artery disease, as we spoke a lot about that in the previous part. Obesity, cigarette smoking, hypertension, and diabetes. Okay, control of pulmonary edema. To manage shortness of breath and fatigue and to control the fluid imbalance that results in pulmonary edema, we have to follow certain steps. And whatever information, all the information that I am mentioning right now at the beginning of this part 2 is good to know. NCLEX alert, okay? Fluid shift mechanism. With decreased heart function, blood accumulates in the vascular system. With decreased heart function, the blood accumulates in the vascular system. So here is the case study you guys are going to work on. Okay. And I'm copying this in a different formats for you to be available. So building up offsets the delicate balance of filtration pressures and causes fluid to collect within intracellular spaces instead of flowing among fluid compartments. So all the shifting fluid is going to cause the fluid to be in the intracellular spaces instead of flowing among fluid compartments. So instead of going in the circulatory, it's going to be in the intracellular spaces inside of the cells. Now, this heart failure is going to cause hormonal alterations. Kidney nephrons sense decreased renal blood flow, which is normally an indication of dehydration and hypovolemia. Okay, so the nephrons are going to be kind of the first one to sense what's going on, dehydration and hypovolemia. Unlike dehydration, inadequate pumping of the heart causes reduced blood flow, but no hypovolemia, okay? Because remember, the fluids are going to be in the intracellular space. Vasopressin form the pituitary gland, which we also know as antidiuretic hormone, and this hormone is going to stimulate the resorption of water in the kidneys. Now, in addition, the adrenal glands secrete aldosterone, which causes the reabsorption of sodium and thus water in the kidneys. Okay, so there is a lot of a good intervention of kidneys, the heart, you know, the hormones that are being released by the brain. So it's a whole participation of different organs. It's kind of complicated to understand, but so far you just need to know that there is a shift in the fluid, okay, and the kidneys, the hearts are participating to create balance, and also the hormones. Okay, medical nutrition therapy for heart failure focus on achieving nutritional adequacy of the diet while limiting sodium and fluid intake to control edema. Okay, so we need to limit the sodium and fluid intake to control edema. I will add also, I will assess for protein levels, albumin. The albumin is the magneto for the fluid. So if the patient is having good protein in the body, probably the albumin is going to pull the water so the patient can urinate, right? Now, this is the part that we need to be cautious, because we don't want to make the patient spend a lot of energy in metabolizing protein. Remember that they are going to have fatigue, so we need to reduce the diet and make simple meals. So that's up to the doctor and to the nutritionist, but they are going to check the albumin to see if the patient can tolerate certain proteins. The adequate intake for sodium is 1500 right now. It's not 2300, it's 1500. In the DRI, which is the Dietary Reference Intake Committees, established 23 as the maximum intake for chronic disease risk reduction. So the MNT, the Medical Nutrition Therapy, okay, guidelines, they mention the following: sodium restriction 2 grams per day, and that's good to know. Sodium restriction is crucial in heart failure, okay. Patients should avoid salty processed foods, pickle, bacon, blah, blah, blah. Fluid restriction is limited to 2 liters per day for individuals with serum sodium levels less than 130. So if a patient is already having low sodium, remember your sodium levels are, the normal is 135 to 145. If the patient is having 130 and the patient is going to keep drinking water, he's going to lose more sodium. And remember, the sodium works in reverse to the potassium. There is a reverse relationship. So if the sodium is going to be low, the potassium is going to be high. If the potassium is high, it's going to compromise the heart. Okay? Either high or low potassium compromise the heart. So you don't want the potassium to go that high when the sodium is low. Dietary supplements, clients may need thiamine, which is one type of your B vitamins, and potassium supplements to overcome losses from diuretic medications. This is the part that is getting a little bit tricky. So if the patient is urinating because the provider is prescribing medications for the patient to eliminate the extra water in the body, right? Now the patient is going to lose sodium. The potassium is going to go high. Now, we are having diuretic medications that the side effect is to remove potassium from the system. So we have the doctor is going to evaluate which diuretic medication is good. Now we need to control the sodium, we need to control the medication that is going to cause the potassium to decrease, right? And if the potassium decreases, the sodium is going to increase. So all those considerations we need to manage when we are taking care of a heart failure patient. The dietitian should evaluate the diet to ensure clients are meeting their dietary recommendation intake for folate, vitamin B12, alcohol, 1 drink per day for women and 2 drinks per day for men. In this, I will strongly, I really don't understand how we can keep recommending alcohol. The patient must completely avoid alcohol if alcohol contributed to the heart disease. Yeah, thank you. Okay, so that is why your PCP needs to test your CMP in order for the nutritionist to create the right plan for you. Okay, you're going to see the sodium, all your electrolytes, your potassium, everything is going to be in the CMP and your comprehensive metabolic panel. Also, we need to check how is the kidney function, right? For the patient to eliminate the edema. Frequent small meals, 5 to 6 per day, are better suited than large meals to prevent fatigue from eating. So there are some diuretic medications that you need to be familiarized. Your hydrochlorothiazide is one of the, I would say everybody starts with that. Then your Lasix, which is your furosemide, aldactone, and your amiloride. Hypertension. Moving next. Incidence and nature. Hypertension is one of the most common vascular diseases worldwide, and experts estimate that is the majority of people will develop hypertension during their advanced years. However, if you remember that we were talking about all these conditions starts in the younger years in childhood. So we can have patients on their 20s with problems with hypertension. This is a silent killer. Yes, it's a silent killer. People don't believe they are having hypertension. They think it's because I'm going through anxiety. I've been so stressed. I having a stressful incidents last week. That's why my blood pressure is high. Okay, so we need to follow up because no signs indicate it's present. Suddenly the patient is going to start having blurry vision. Okay, and is going to the ophthalmology, and probably the ocular pressure is going to be normal, so the doctor is not going to suspect hypertension. Probably the patient is going to have ringing in the ears, numbness, tingling in the extremities. Okay, is going to have problems focusing on studies or simple tasks. Okay, and those are signs of hypertension, but many patients, they don't go, no, you know what, I was not focused on this because I was having stress, right? I'm having numbness and tinglings in my arms because I've been carrying a lot of packages lately. Okay, so they don't believe. Many people, they try to be on the blind side. They are on negation. They are on denial about the blood pressure. 46% of American adults older than 20 years old have hypertension, and many of them are unaware of the condition. The incidence of hypertension is higher among Black or African Americans than in whites, Hispanic, or Asian Americans. And that's good to know. You need to know your statistics. When speaking of the chronic condition of elevated blood pressure, the term hypertension is more appropriate than high blood pressure, because blood pressure may occasionally be elevated due to situations that involve overexertion, anxiety, or stress. So the proper term is going to be hypertension. High blood pressure is something that can happen occasionally. Now we have essential or primary hypertension, the predominant form of hypertension. Then we have secondary hypertension, is a symptom or a side effect of another primary condition. For example, individuals with kidney disease or have secondary hypertension. I've seen this secondary hypertension in diabetic patients, right? The big problem is the sugar, the glucose, that is inside of the arteries and veins, and is also collaborating to the cholesterol plaque. So the patient develops the secondary hypertension, when in fact, if they correct the previous causes, this could be eliminated, right? Suggestions for no low sodium seasoning. So we have fish. For the fish, we have tarragon, savory, dry mustard. For the beef, red pepper, chili powder. For the poultry, this part in the book is excellent, let me tell you, because it's going to give you ideas of how to prepare your meals. This is the part that I really like. It's amazing, really. And please take advantage of this. You want to cook a salad with coleslaw, you can season with dill, caraway, poppy seeds, rye mustard, ginger. Try, guys, try it. Instead of using that much salt. For the vegetables, you can use ginger, sesame seeds, basil, onion. I usually use for my asparagus that I cooked in the oven. I bake them because I buy them frozen, organic. So I bake them for 10 minutes with just a little bit of pepper and extra virgin olive oil, and yes, a little bit of salt, but I use Himalayan salt, and I don't have problem with the heart, and I use very little salt. So a family history of hypertension significantly increases one risk of developing hypertension. Children of hypertensive parents are more likely to develop this condition as early as their first decade of life, as I was explaining before. So if the child is developing hypertension in their first in their 13, 14 years old, for sure this is going to be a history, a problem, a disease when he becomes adult. And that's good to know. Obesity worsens the condition through a multitude of pathways, including inflammation, oxidative stress, renal damage, altered blood circulation, impaired endocrine response. Wow, this is the extent of obesity. Endothelial injury, we spoke about that. Sympathetic nervous system dysfunctions, neurological. So the obesity is going to cause kidney functions, is going to cause oxidative stress, which is the aging of the cells, accelerating process in the aging of the cells, inflammation, poor blood circulation, blah, blah, blah. So smoking also increases blood pressure through nicotine-induced vasoconstriction and the promotion of plaque formation, with further restricts blood flow. Other risk factors include excessive alcohol consumption. That's why I prefer to tell my patients avoid alcohol, period, right? High sodium intake and insufficient dietary potassium, magnesium, calcium, vegetable derived protein like fiber and unsaturated fat from fish. And all this section is that good to know. Here is a nice diagram, the prevalence of hypertension. Okay, when the systolic is more than 130 and the diastolic is 80. So, you know, the normal blood pressure is 120/80, right? So you can analyze this table. High blood pressure levels. Blood pressure measurements indicate the pressure of the blood surge in the arteries of the upper arm with each heartbeat. The numerator of the fraction measures the force of the blood surge when the heart contracts. So diastolic is related to the heart contraction. And then the denominator of the fraction measures the pressure that remains in the arteries when the heart relaxes. That's your diastolic. And the normal is 120/80. Elevated blood pressure. Individuals with blood pressure measurement that are above normal but are not so high as to meet the diagnosis criteria for hypertension, and also as having elevated blood pressure, also known as pre-hypertension. I would like also to include patients that are having white coat hypertension. Those patients are scared from the primary care provider. Every time they go to the doctor, they have hypertension. That's white coat hypertension. It is similar in the regards of prediabetes. The assumption is that without intervention, the client will likely progress to stage 1. So we are going to start with the algorithm. Step 1 is the lifestyle modification, right? The American College of Cardiology, which is the ACC, and the American Heart Association, your AHA, okay, they recommend certain indications. So one is weight loss, okay. Then adopting a heart healthy diet, such as the DASH diet, stands for dietary approach to stop hypertension, the DASH diet. Then reduce the sodium intake, yes. Increase potassium intake, yes. Moderation of alcohol use, okay. They should put avoid alcohol. Regular physical activity with a structured exercise program. And 7, cessation of smoking. So they mention stop smoking, but they cannot say stop alcohol. And exposure to secondhand smoke. Sorry about my thoughts, but okay. So this is NCLEX Maximum Alert, the DASH diet. It's low in salt and rich in fruits, vegetables, whole grains, la la la. Risk factors for hypertension. Here are very nice table, the modifiable risk factors. You see, the diabetes is a modifiable because if the patient loses weight and controls the sugar, they can control diabetes. Hypercholesterolemia, the obesity, sedentary behaviors. Now, risk factors that are difficult to change. This is important. Socioeconomic status, low education, obstructive sleep. So here we are in advantage, right? Low education, we are nurses. So we are having all this material to put it in practice, okay? Now, with the help of the nutritionist, we can create a good dietary plan for those people in low socioeconomic status. Okay. Non-modifiable risk factors are family history, race, ethnicity, increased age, and male sex. And I would say that in functional medicine, we strongly believe that the family history and the race, ethnicity, with the good environment for the cell, these factors are preventable, are modifiable. Okay. Classification of blood pressure for adults and treatment recommendations. So we have the stage 1, which is 130/39, right? Let me start with the normal. So normal is less than, the systolic less than 120 and less than 80, right? So no pharmacological. For elevated, which is between 120 and 129, that would be considered your pre-hypertensive patient, okay, and less than 70. For example, this patient is 124/74, okay, that is a hypertension stage, pre-hypertensive. Not indicative, reassess in 3 to 6 months. Now, in stage 1, hypertension, 130 to 139. So here comes your 136/88 patient, for example. If patients' 10 years CVD risk is less than 10%, the first line therapy is a strict adherence to lifestyle modifications and reassessment in 3 to 6 months. Okay, my friend, you need to stop eating this type of food, and you need to start to change your lifestyle. Okay. If patient has diagnosed atherosclerosis or elevated 10-year CVD risk, healthcare provider will initiate hypotensive medication and reassess patient in 1 month. So that's why it's very important to have your application to see if the patient is on CVD risk. Stage 2 is the patient that the high blood pressure is above 140. So here is 140 and 94, over 94. Remember that the diastolic above 90 is telling you that there is a left ventricular issue. The left ventricle is the one that is pumping blood to the whole body. So above 90 is concerning. I don't have to wait for a patient to be 150/100. No. 141 above 141 above 92 is already a concern. Hypotensive medication initiated, reassessing 1 month. If goal not achieved, healthcare provider will adjust dose and add other medications to treatment regimen. So this patient is gonna end up having diuretics, 1 medication for hypertension, 2 medication for hypertension, and if the patient has comorbidities, he's gonna take medication for that comorbidities, this and that. Okay, plus maybe patient is going to start on potassium medication. So if we treat these conditions with good nutrition from day 1, okay, I honestly don't think we have to wait from pre-hypertension for the patient to be assessed in 3 months. We need to start lifestyle and nutritional advisement, right there in pre-hypertension. That's why nutrition is so important. Best proven lifestyle interventions for prevention and treatment of hypertension. You have the weight, body, fat loss, okay. You have the healthy diet, the DASH diet. And if you follow the DASH diet, probably your hypertension is going to be reduced in 11 mmHg. Okay. Reduce dietary sodium intake, the enhanced dietary potassium intake. But in this table, the most effective is the DASH diet. If you see the hypertension and normotension, means that the patient is having normal blood pressure, and if they follow this diet, they are going to reduce a couple of numbers. but the most effective is the DASH diet. I would say the aerobic exercise as well is very effective, and the reduced dietary sodium intake, in that order. Okay, so now let's move to stage 1 hypertension. Healthy lifestyle modification, blood pressure lowering medications depending on the case. Diuretics are one of the first line medications. As I mentioned before, we need to follow the algorithm. So the American Cardiac Association, they are treating everybody the same. They have the algorithm. The continuous use of some diuretics may cause a loss of potassium, as I mentioned before. Potassium replacement is sometimes necessary. Dietary replacement with the increased use of potassium-rich food, like bananas and orange juice, vegetables, legumes, and whole grains are important. So that's good to know. Orange juice, grains, good snacks for hypertension. Orange juice and whole grains, whole wheat bread, or okay, good for hypertension. Stage 2, in addition to the lifestyle modifications for stage 1, vigorous drug therapy is necessary for stage 2 hypertension. All different types of hypertension medications. So you see, the AACC and the AHA guidelines provide practitioners with a dietary algorithm for initial and evaluating drug therapy for hypertension management. Grapefruit juice and drug metabolism, okay, is something that you need to double check for more information about potential interactions with the medication that are often used for hypertension and CVD. Nutritional therapy is important for all levels of hypertension, along with other non-drug therapies such as physical activity, smoking cessation, and moderating alcohol. So the medical nutrition therapy for hypertension, and this is the drug nutrient interaction. They are talking about grapefruit juice and drug metabolism. Well, when in fact grapefruit interacts with many drugs, like for example metformin, okay, which is a diabetic medication. A common pathway for drug medication makes use of the enzyme CYP3A. So this enzyme is in the liver, okay? So these medications, the medications for hypertension, usually go through the liver first. This enzyme oxidizes lipid-soluble drugs. Remember that the liver participates on the fat and cholesterol metabolism, thereby making them more water-soluble in preparation for urinary excretion. As the enzyme oxidizes more of the drug, less of medication is bioavailable for its intended action. So several cardiovascular drugs make use of the CYP3A pathway for metabolism. The table below shows some of the cardiovascular agents susceptible to grapefruit inhibition of CYP3A and the associated side effect. Hospital and inpatient facilities do not serve grapefruit juice, that's true, and clients who are taking drugs that use the CYPA pathway for metabolism should avoid drinking grapefruit juice at home. So as a nurse, you Google, right? Or if you have a pharmacological application, if you are not in your hospital and you want to take care of your family member or friend or parents, whatever, or by yourself, there is one called Hippocrates, and you download this app. I think you have to pay something, but if you're a student, you have discounts, and you can see all type of conditions, what type of treatment, how the amount of dosage for the treatment. You can see the interactions, the contraindications, the warnings. It's very helpful, okay? So the grapefruit is going to appear definitely. So you have the amiodarone, amlodipine, atorvastatin, right? For example, in the case of amlodipine, the additional comment is alternative calcium channel blocker, verapamil are available that do not interact with grapefruit juice. Okay, so instead of giving amlodipine, probably you can give verapamil. Okay, NCLEX alert. Atorvastatin, okay. Alternative medications in this class are available that do not have significant interaction with grapefruit juice. For example, fluvastatin, pravastatin, rosuvastatin. These are the statins for the cholesterol, right? Very important. So that's good to know. To NCLEX alert. Remember that the NCLEX, 30% of the NCLEX is going to be pharmacology. So you need to know that. Okay, so now hypertension is one of the most critical risk for factors for CVD and stroke. Maximum NCLEX alert. You need to know hypertension is #1 most critical risk factor for CVD and stroke. The American Heart Association dietary and lifestyle recommendations to reduce the risk for CVD. We have to consider weight management, as we spoke before. We have to, in the way the patient starts losing weight, you keep monitoring the blood pressure, okay? Physical activity is very important. The DASH diet, okay? So in the physical activity, you need to remember, okay, how many minutes per week. That's also coming in NCLEX. The DASH diet also that we recommend when we were analyzing that table is the most effective to reduce hypertension and the risk for CVD. Okay, so you can keep an extra eye on the amount of servings of this diet. And we have sodium restriction, and also we need to consider potassium. Okay, and there is an inverse association between potassium intake and blood pressure. High potassium intake lowers high potassium intake, hold that thought, lowers blood pressure in hypertensive individual. Okay, so here I just skip this amazing material, the DASH eating plan. So here they are telling you the calories per day, right? You can choose 1600, 2000, 26. And they are telling you how many servings of grains, vegetables, and fruits, how many servings of fats-free, low diet, lean meat, how many servings, the nuts, the fats, the oil. Okay, here already you are saving some money. If your insurance does not cover nutritionists, here you are saving a lot of money. So with this table, you can create a plan. But on top of that, the book is giving you a sample one-day menu on the DASH diet on 2000 calories. So you have your breakfast, you have your bran flakes, your medium banana, low-fat milk, you know, and a cup of orange juice. Remember your orange juice, that's good to know, is a favorite in DASH. Your lunch, okay? The lunch, because the orange juice, think about it, it's a citric, it's full in vitamin C. So if a patient is having hypertension, is having problem in the endothelial inside of the vessel. That's why macrophages are coming to attack the inflammation. And if you get vitamin C, you are going to somehow support that protection that the macrophages are trying to provide to the body. Okay, lunch. You have your fruit cocktail, right? You have your chicken salad. Dinner, you have your small apple, baked potato with the following snacks. I mean, this is amazing. I really like this part of this chapter because a diet rich in potassium containing fruits and vegetables, DASH diet reduces the risk for hypertension as well as other chronic disease. Okay, so the recommendation for a potassium rich diet is also part of the dietary guidelines for Americans 2025 and the guidelines for CVD prevention. Additional lifestyles modifications, they are talking about limiting alcohol intake to no more than 2 drinks per day for men. Okay. Additional lifestyle factors that are associated with hypertension include smoking, we know that, secondary hand smoking, and chronic psychosocial stress. You cannot imagine how come a blood pressure for somebody can change only from stress. Okay, you cannot imagine that. You can be from, you can have regular blood pressure and something happens, you realize that some of your family members were through an accident or something happened, you are going to become in stage 2 hypertension. That's why I strongly suggest you, since you're going to start entering into the healthcare and you're going to become a nurse, okay? If you work on bedside in a hospital, forget about it. You need to have a backup, how you're going to manage your stress. You need to either do yoga, you do your meditation, I don't know, you pray your rosary. There's something that you have to do to manage your stress. If not, you're going to start developing hypertension or any other condition. Plus, nurses, even though we know we have a lot of knowledge, we don't practice healthy eating. When we have time, right? Because sometimes we don't even have time to go to the bathroom in the middle of the shift. When we have time, we are just craving for some sweet, some good sandwiches and French fries. I've seen it. I know what I'm talking about. So it is good to start practicing and preparing whole foods and bringing your all meals um, to the shift. Educational prevention, nutritional education, food planning, that's what I'm talking about, and purchasing, right? Not only for the patients, but also for you. You have different sources. You have My Plate Guidelines, which is great. And there is a website here. You have the American Heart Association and the Academy of Nutrition and Dietetics also provide heart healthy eating resources. Read the food labels, please. Read the food labels. That's the beginning of everything. Okay, be aware of what you are bringing home to put in your refrigerator, because whenever you feel cravings at home, when you open the refrigerator, that stuff is going to be there. If it's unhealthy, you're going to eat that, but it's not unhealthy and you have a good amount of vegetables and fruit, that's gonna change the game. You have to use fresh whole foods primary with a limited selection of frozen foods. Food preparation, use the seasoning recommended in that table that we saw a few minutes ago. And we can use less animal products overall and in leaner and smaller portions. Combined with complex carbohydrates. I spoke about that in a previous chapter. Those are the carbohydrates that are going to be absorbed slow, so the energy level is going to stay there for a long period of time. Example, your sweet potatoes are complex carbohydrates, and if you love your potatoes, the way to convert a regular potato into complex high carbohydrate would be to leave the skin on. So you wash very well the potato with the skin and you cut it in slices and you put it in the oven. Instead of peeling the whole potato, that would be a simple carbohydrate, and the energy provided would last like 5 to 10 minutes. And you feel the need to eat more and more. Okay? So person-centered approach, special attention to personal desire, ethnics, la la la. Yes, it's very important. Cultural sensitivity. Principles of education, starting early. As we mentioned, we need to provide good food to the children, okay, because of the memory cell. And focusing on high-risk groups, yes, our grandpas, our neighborhoods that are 60s, 70s, okay, using a variety of resources. All these resources, the Academy of Nutrition and Dietetics provide a website. Everybody has a website. Cultural considerations also, for the socio-demographic, this and that. And then we are done. We finished this chapter. Excellent chapter. Chapter review questions. High serum level of which of the following lipoproteins is protective against CVD is HDL. The best sandwich choice for a client on a diet with sodium restriction would be grilled chicken instead of hard salami. Packaged ham slices. The combination of the DASH diet with a low serum diet significantly reduces blood pressure. And then you keep going practicing your question. You have your NCLEX generation examination style, right? And that's it. So we're done with chapter 19, and with this we conclude the series of chapters towards Unit 1 exam. Okay, the blueprint is that's good to know. Okay, so you know exactly what I'm going to test you about these chapters. Thank you so much for your attention. See you next time.